right, we mentioned dogs so much that we have one on stage. So, almost at the end. This panel is particularly important to the Sumaira Foundation. I think in the beginning, when she was introducing a little bit about herself and what drives her to grow and establish the foundation more, she really, really cares about diversity. And you know, we all know NMOSD does not touch a single race or a single ethnic background. It affects people of all races and all ethnicities. And you know, here in the United States, we live in a melting pot. And as we're trying to establish more individualized approaches to care, we really need to make sure that we're putting things in place to meet the needs of different people with different needs. So with that, we'll just go around very quickly. I'd please ask everybody to introduce themselves, where they're from, and what brings you here. So Saran, I'll start with you actually.
All right. Hello, everyone. I came here from like Long Island, so it was like a bit of a drive. Yeah. So, and my name is Saran. I'm a Pakistani American, and I have NMOSD.
Hi, everyone. My name is Marion Jones. I reside in Boston, Massachusetts. I'm actually a neighbor to Sumaira, so I'm the person that kind of keeps her on task from day to day in the neighborhood. I was diagnosed with NMO in November of 2020, so next weekend exactly will be 3 years of living with NMO.
Hi, my name is Amy Yu. I'm a neuroimmunologist. So my connection to all of this is I did my fellowship training here at Columbia University, which I completed this past summer in 2023. I have since now moved to South Florida for personal reasons, my significant other, and I'm building a subspecialty practice there and being able to, my goal is to be able to bring kind of the newest and most up-to-date medical care in the subspecialty to the patients in the South Florida community.
Hi, good afternoon. My name is Tia Brooks. I'm from New York. I was actually diagnosed with lupus first and then diagnosed October 12th, 2009 with NMO. It's been a real roller coaster with both. I think NMO is actually the bully of the two, which my doctors seem to say. And it's changed my life. It's opened my eyes to a lot of things. I actually want to say thank you to NMO because it's brought me to a journey to where now currently I am a fitness instructor. I am teaching kickboxing 6 days a week. I box 5 days a week, and I also do martial arts. Coming from losing my vision twice, being from the waist down paralyzed, and being told that I was probably not going to have any motion to my left arm. Currently, I will say I throw a really mean jab and a really mean cross. And every morning that I work out, I take 5 minutes to pray and say that if I didn't have that drive, I don't think that I would have come so far that where I'm at today. Thank you.
Hi again, I'm Germs. So I'm an MD from the Philippines and I have double seronegative NMO. And I'm currently doing double seronegative NMO research with Dr. Michael Levy and the Mass General Brigham.
All right, so Dr. Yu, I'll start with you. You were born in Taiwan, and you and your family moved to the United States when you were young, about 5 years old, if I remember correctly. So can you tell us about kind of the challenges your entire family face navigating an already complex healthcare system when you're moving countries, you're trying to establish yourselves, and then get yourselves entered into the healthcare system?
So I think healthcare is a very complex space. Seeing my parents as immigrants speaking Chinese, we were actually in Los Angeles, very culturally diverse location as well. But seeing the My parents, they're wonderful, but they didn't have the ability to go to college. Their health literacy is somewhat limited, and their understanding is also somewhat limited. And in Chinese culture, there's a little bit of a deference to authority. So sometimes you're not, as a patient, you're not encouraged to ask ask your doctor questions or clarify something if you don't understand. So growing up, I sometimes served as an interpreter for my parents if they're at medical visits, helping them take notes and make sense of what the doctor was saying in that 5-minute visits, the in and out. So I think that's shaped a lot of how I approach medicine in the individual visits, and also understanding the challenges of navigating healthcare. A little bit side note, not many people know about this, but my mother, when I was younger, was uninsured and she had acute appendicitis. What happens? You go to ER, you get a large hospital bill. So these are the little things that are constant challenges and barriers that kind of exist, and I think that's shed a lot of light for how I like to practice and approach medicine and my care of patients.
So to that point, having that experience firsthand, what kinds of things and systems have you put into place to help some of your patients who may need some translation services, may not be as literate, need more support, but yet have that obvious urgency to want to have that shared decision-making type relationship with you as a patient?
I think step one is acknowledge whichever barriers might be. Is it a physical barrier? Is there a financial barrier? Is there a language barrier? What is the barrier? And just simply acknowledging that first. Because if you don't acknowledge it or know that there is a barrier, it won't be addressed. So that's number one. Number two, and I think what we've seen throughout this entire day, is the need for multiple players on the team. A large part is an office staff, kind of what Betsy was describing before. Is the office staff friendly? Are they helpful? Or are they not nice? That's part one. Part two is, do you have a social worker or someone to help you navigate the challenges of insurance and this and that? That part is also very important, along with any kind of pharmacy staff, infusion services, if relevant. So I think it's a lot about teamwork, and it's not, I'm one part of the team, a patient is another part of the team, but it really takes a community to be able to address all these different issues. But number one is acknowledging it, taking a step to just recognize the problems, then being able to proceed.
Thank you for sharing that. Gerome, I actually have a question for you. So, you as well come from the Philippines. You have also a different lens into kind of comparing one healthcare system to another. And can you just compare the care you received there versus the care you're receiving here? And, as you said, you're a 00 negative patient, so you're still in this process of trying to seek answers for yourself. But maybe can you share a little bit about, what you feel you've received here in the U.S. or may not have received compared to the Philippines?
So it's really different because, like, back in the Philippines, majority of our majority of the patients we are on an out-of-pocket state. So if you don't have money, unfortunately, you can't even get tested or even see a doctor. So unlike here, I know the healthcare system is not a perfect world, but for me, as coming from the Philippines, it's better here because my insurance is covered by the university at Harvard, so I get everything. I think I do just only a little amount of copay, but back in the Philippines, it's really out of pocket. That's why, because I'm still in contact with my neurologist back there, there's a lot of SRNA negative NMO, but they don't have enough money to test for MOG. So we're not, he said it to me that for sure there's still a lot of patients here, but they don't just have the means to get tested. And then also for treatment, when I transferred here last year, when I got in touch with my new neurologist at the Brigham, she offered me like a lot of like medication actually to choose, actually not necessarily choose but recommended. But back in the Philippines we only have Rituxan. That's it. If you're if you're aquaporin positive, you get that. If not, or if you have MOG, you only get that. So we still have a lot to, improve back in the Philippines. So I hope my hope is that for the medications here reach there. Hopefully, when like if I finish my training here and then bring it there, hopefully, yeah.
So, I think we were sitting at the table together and you were talking about how, you are, well, in the Philippines, you were seeing patients at that time. And you were more open about your own rare disease, right? And it obviously allowed you to have a different connection with your patients. And, obviously nobody wishes that doctors also are living with the conditions that they're treating patients for, but how do you think doctors can kind of speak to their patients in their manner? For example, you're a male, Saran, you as well. NMO is a female-dominated condition, and it may be hard for males to talk about things like sexual dysfunction and incontinence. So what are the types of things we can keep in mind when a physician is trying to have an open and honest conversation with their patients to just obviously make them feel better?
In my perspective, since I have the disease, it was actually easy for me to build rapport to the patient, I think. Because so again, going back to the question earlier about treating patients, I'm very open about my disease. So, because NMO, for NMO, I think majority is like chunk of it is at the history. Yeah, we're very particular with when did the symptoms start, how did it progress. So, I think as a doctor with NMO, it was easy for me to like interview patients, and it was easy for them also to acknowledge their symptoms. So so yeah, that's it.
Yeah, I think, obviously the physician being more open with the patient being more open with the physician is extremely important. And speaking of openness, so Saran, I want to ask you, tell us about some of the symptoms you have dealt with having NMO.
Well, my condition, first I started having these attacks when I was age 7 basically, and it was not diagnosed till I was 8.5, so it took quite a while because they were treating me for ADEM or MS, but they didn't think it would be NMO. Yeah, so after I lost vision from my left eye, that's basically when they sort of treated me and diagnosed me with NMO. And the struggle was basically I guess because NMO wasn't really known at the time. It was 2008, so I really had to listen to my mom, the things she was telling me. I was really confused at the time because it was a new process for me, I guess. You know what I mean?
So in your work environment, for example, do you feel like your employer is making things more comfortable for you as somebody who has some visual impairment? Are you even open about that so they know they should be that way for you?
Honestly, I don't really share that about me. I just try to perform as the best as I can, basically. But I don't really relay that fact that I have NMO to outside my immediate circle, basically.
Yeah. Are there things you wish they did have in place to help you perform in a certain way at work, or you think everything is fine as is?
Honestly, I think everything is fine. It's just that sometimes I lack focus, and as a lot of other people have said here, brain fog and stuff like that.
Yeah, I mean, I think we want to be in a place where that's not judged or stigmatized, right? If you need a break at work, I mean, any of you, I don't know if, Tia, for example, you're in a very active field. If there's a moment where you need a break, are you comfortable enough to say it, and are people understanding of it?
Now, yes. I think they know when I come in, and I'm not that energetic person. very quiet. They're like, she's having one of those days. And I learned that I have to let people know how I'm feeling, because then it could be interpreted as something completely different. So now, on those days when I need to just sit at the desk and not instruct, that's what I do. And it just makes the work environment better. If we just have open communication. And we do now.
Good. Gerome, did you want to say something?
Yeah, because I echo on that because after my master's, I'm planning to apply for residency for neurology. And I've been asking a lot of like neurologists if, because like with the ADA, I'm covered that it's okay if I don't tell them that I have a disability, right? But for me, in my case, I want it to be like I want it to be my story. My NMO is my story, you know. I wanted to use it as like an advantage. But then when I look at NMO, it's like a double-edged sword. At one edge, it's like, hey, I'm this inspiring medical doctor applying for neurology. And on the other side, I was like, oh, I am a big liability for this hospital during residency. You know, I've been asking a lot of like neurologists whether I should disclose it or not. But I think I came into terms that I'm going to disclose it because, again, you want to land in a workplace where they accept you, you know? I'm like, it's going to be hard to be like, okay, I get accepted at this neurology residency program, but I didn't then they don't like me or they don't have the means to accommodate me. So I think, it's very important to like advocate for yourself and be open about it, but it's okay. For others, take your time. But I think I came into terms that I'm going to disclose it no matter what.
Thank you for sharing that. So I'm going to switch gears a little bit. Marion, so you live in Boston now, but you were born in the South in Mississippi. I don't know exactly where, but I'm sure you have a lot of insight into maybe some of the challenges that patients face accessing specialized care, especially if they live in rural areas. So, obviously you want to make sure that there's equity in that respect. But tell us about some of the challenges people living in rural areas face navigating their NMO diagnosis and treatment plan.
Yes, so I was born in the South. I was born in Jackson, Mississippi, to be exact, which is the capital city of Mississippi. And I was diagnosed with NMO in Massachusetts. And so it's interesting because I consider myself one of the fortunate ones to have been diagnosed in a place like Massachusetts. I started to show symptoms. It started in the form of a migraine that eventually migrated into my neck area. And when I first went into the hospital, they told me that, they asked a series of questions around my health. They said, you're young, you seem to be relatively healthy, you don't have a history of migraine, so we're thinking that this might just be a tension headache. And so they gave me a prescription for muscle relaxers, and I went home. And so, long story short, I was back in the ER because I started to show symptoms on the right side of my body. I started to lose mobility, and I started to drag my leg, and I wasn't able to really lift things with my right arm. And so when I went into the hospital, when I went back into the ER, there was a neurologist on duty that evening, and during that visit, they had an MRI scan conducted and was able to diagnose me with NMO. So when I say I feel like I'm one of the fortunate ones to have been diagnosed in Massachusetts, I say that because I was diagnosed within a matter of 72 hours after the initial visit into the emergency room. However, going back to being born in the South, where there are many challenges around healthcare equity, and also many challenges around the quality of healthcare. And so I know just from talking to individuals who have been diagnosed in the South that their diagnosis process was there were many barriers. There were doctors who, first of all, there were individuals who were diagnosed, and the doctors that they were diagnosed by were actually in areas where they had to drive to another city, or there wasn't access to care in their, in their area, in their zip code. And so, in particular, when we think about the rural areas, we know that the disparities in those areas are far greater than just some of the disparities that we see across the South. And so I was looking at a documentary the other night, and it talked about how we are introducing technology, or trying to do a better job of introducing technology into some of these spaces, so that these rural areas where the specialists are not on staff at those hospitals, or they don't even have hospitals in close proximity, that we are able to get individuals educated on ways to use telehealth, so that they can communicate with doctors in their area, and so that the diagnosis process isn't further delayed. Because we also know that for African Americans in particular, our diagnoses, we are often misdiagnosed, and so you hear that we're often misdiagnosed with MS, and or we are the diagnoses process is just significant delay. There's significant delay, and so when you think about the stories that you've heard today, and you think about delay with a chronic autoimmune condition such as NMO, and being misdiagnosed, which means that you're probably on a treatment plan that is counter to the treatment plan that you should be on to address the issues that you have, definitely just shows that we have a long way to go in terms of health equity.
Yeah, and as we said earlier, NMOSD disproportionately affects Black women more than anyone, and I think it's just really frustrating for individuals to have to experience that. I mean, and also when we see worsening outcomes for Black women, I mean, I think there needs to be a much more priority and focus on making sure that the highest risk populations are getting immediate access to care. And obviously, there's no simple way of addressing that. There's just challenges we have within our healthcare system, but I do think there is a tremendous value in telehealth to at least connecting somebody with the right specialist. And on top of that, there is, a rarity of neuroimmunologists, not only in the United States, but around the world. And so I think the good thing that we're seeing is there's a lot more connectivity and collaboration with those rare group of neuroimmunologists. And to be honest, I'm sure, Samira, you can agree, you only see that growing more and more and more. And we will get to the point where people are diagnosed in a timely manner. But thank you for sharing that perspective. Tia, when Samira asked the audience if anybody has ever met another patient with NMO, I saw you raise your hand that this is the first time you've been in another room with an NMO patient. And you were diagnosed in 2009. There's a lot that has changed since 2009. There's more medications, there's innovation, there's research, and most importantly for people, there's a very established, growing patient community. So I just want to know from you, how does it make you feel to be in a room with so many other people living with an incredibly rare condition? I mean, it's rare to be in a room with rare people, but it's rare to be in a room with people with the same diagnosis as you. How does that make you feel?
Listening to the stories, I felt like I'm not alone. I speak to a lot of people online. When I have a question, instead of sometimes going to my doctor, I'll go to one of the groups, and they have the answer faster than I can get information from my doctor. I actually learned about Rituxan from a friend that I met in a group, and I mentioned it to my doctor, and he said, okay, we'll give it a go. And we gave it a go, and it's been the best thing. But now, listening to so many other people I guess they've tried other things, I want to try too.
Yeah.
I want to see if there's something better that I'm missing out on. And I heard someone mention earlier, maybe it is time for me to get a second opinion. Maybe it's time for me to go to another doctor. maybe he doesn't have anything else for me. Maybe I need to seek,
Yeah.
help somewhere else now.
Yeah. Go ahead.
And I want to segue into this. Thank you for sharing that, Tia. From a physician perspective in neuroimmunology, there's really not too many of us. However, this disease, both MOGAD and NMO, can be very, very disabling. And I think I think we'll talk about this as well, but I think the key starts with patients and families. Feel empowered to question, to challenge, to ask why, to inquire and kind of push the boundaries a little bit. Sometimes in medical visits, there is that default power dynamic with the kind of authority figure of a physician who knows, and then the patient, we're kind of there asking for help. But I think especially in a rare disease, be empowered, feel comfortable. And if the person that doesn't make you feel comfortable to entertain challenging thoughts or question, then maybe it is time to see someone a little bit different, because it has to be a partnership. It is about the teamwork.
Definitely, especially with myself, I have to see rheumatology, and then I have to wait for neurology, and then they have to get together, and they never agree. And then it's just me sitting there waiting who's going to make the final decision.
Yeah, I mean, in a way, you might need to play that quarterback role too, right? You are also the own kind of decider in your health, and you're now continuously doing research, and I'm sure, like as you said today, you've learned a lot. And I hope you do feel much more empowered to now ask these, what you may think are challenging questions, but are questions that every patient should be asking their doctor. And you have the support system now. You can see that most doctors are receptive to this. And if you're in a situation where you're just being talked to rather than talked with in a collaborative way, I mean, yes, I think it's time for a second opinion. And it's totally okay. I mean, a lot of patients say this. It is totally okay to fire your doctor, if you're not happy. Not that there's any animosity, but you need to make sure that you're also extremely comfortable and you feel like you're on the right path to make sure that nothing else is going to happen in regards to your NMO journey. So I saw you wanted to say something.
Yeah, I wanted to say, like, sometimes it's a lot because, like, collaborating with, like, different doctors, like, about, like, your underlying condition of NMO, because, like, sometimes, like, there's, like, other conditions that, like, arise from it, basically. Like, for me, myself, I know I have, like, not just NMO, but, like, due to, like, a complication with my rituximab infusion, I basically, like, had, like, seizures when I was, like, 13-ish, yeah. And other than that, I would say, like, basically it's, like, sometimes, like, collaborating with, like, doctors together is, like, kind of tough, so I think that should be worked on, too, you know what I mean?
Definitely.
Go ahead.
I think one of the first things that, so this was, I think maybe a day or two after I was diagnosed, it was a height of COVID. I live in Massachusetts. I have no family there. So I was in the hospital. I was, terrified. And I just remember another doctor coming into the room, and he looked at me and he said, "We're going to try some things with you." And he said, "But I want you to know that you are not a guinea pig. You are a part of this process." And he said that to me, and it just stuck with me, because you do have to advocate for yourself. You have to educate yourself. You have to read. You have to go in with notes. I was diagnosed with COVID last year, and there's a pill that you can take during the early stages. And I remember doing some research, and I wasn't, able to take that pill because of a medication that I was on. And so I remember, sending a message through the portal to the doctor to see, to let them know that I had COVID. And one of the doctors that was on staff called me back, and he said, "How long have you, been showing symptoms?" And I said, "Maybe a day or two." He said, "Well, we can write you a prescription. You can go and pick up the pill." And I said, "No, I can't pick up the pill because of medication that I have for NMO that conflicts with that." And he said, "No, I'm not quite sure. I think, let me check." And then he came back on the phone. He said, "Oh, you're right." And so you just have to know that this is your body, and you have to be your biggest voice, your biggest advocate all the time.
Yes. I think that's a good place to end and ask if anybody has any questions before we close this panel.
I'm just going to add one thing.
Yes,
I know that
Amy, go
Sumaira Foundation has been working hard on DI, and there's a coalition comprised of patients, caregivers, physicians, and I think if I remember correctly, on the survey, there was a survey of what is like kind of the biggest unmet need, and a lot of it was access of being able to access the subspecialty knowledge, and if you're having a symptom, you know, kind of like what Ireland had earlier on with this back pain and this nausea, not having it be just blown off as nothing, but being able to potentially get a more in tune set of eyes to review a case to get to a diagnosis sooner. You know, I think that's something it'll be a challenge in terms of navigating HIPAA, legal issues, cross-state line issues, but I think it's an effort that is already being undertaken, and I hope that in the near future, for all future patients, we can get to a much quicker diagnosis with less runaround.
Yep.
Definitely.
Any questions? Jill, is there anything online?
No questions online. But
Okay.
Any questions?
All right. Thank you all so much. This panel is always great. This is the third time we do it, and you know, there's so much to take away from this. So thank you all so much.
Thank you for having me here.
Thank you.
Thank you.